So I've checked the patient's chart, performed hand hygiene. I'm going to enter the patient's room and provide for privacy. And then introduce myself to the patient, explain what I'm going to be doing, and identify the patient with 2 identifiers. Hi, I'm Becky. I'm your student nurse today. Could I see your wristband, please? Could you please tell me your name and your date of birth?
Olivia Derricks, 8/27/2005.
Thank you. Today I'm going to be doing an assessment on your musculoskeletal and your neurological system today. Is that okay? Okay, great. The first thing I'd like to do is note that the patient has proper grooming. They look like they're appropriately groomed and clean. She's wearing appropriate clothing for the season. She is body posture is erect, which is a normal finding, and body movements are voluntary, which is what we're looking for. Okay, I'd like to ask you some questions. Is that okay? Have you ever had a head injury?
No.
Have you ever had vertigo, dizziness?
No.
No. You ever had a spinal cord injury?
No.
Have you ever had spinal meningitis?
No.
No. Okay, great. You don't experience any headaches or anything like that?
No.
No dizziness, vertigo?
No.
Okay. Do you experience any muscle or joint pain at all?
No.
Okay, great. The first thing I'd like to do today is ask you your name again. Can you tell me your name?
Olivia Derricks.
What's the date today?
11/15/2016.
Where are you at? Do you know?
My house.
Yeah, so that indicates that the patient's alert and oriented ×3, so that's a really good finding. Okay, Olivia, I'd like to have you stand up. And if you could please walk heel to toe 10 steps forward and 10 steps backward, please. Okay, and the patient's gait looks good. Next thing I'd like to have you do is put your feet together. I'm going to perform the Romberg test. Close your eyes, please. Okay, and notice how the patient's naturally swaying. That's actually what we're looking for, and that indicates that cranial nerve number 8 is intact. Okay, thank you, Olivia. If I could just have you shrug your shoulders for me. Okay, that indicates that cranial nerve number 11 is intact. Okay, and the next thing I'd like to have you do is, if you could please place your finger to your nose, one at a time. Yeah, put it down, other one. Okay, and that's a good sign. They were able to do it, and that means that they're coordinated, so that's good. If I could just have you sit down for me. I also want to note, too, that the patient seems very logical in their thought process and oriented in speech. Speech is appropriate, so that's exactly what we're looking for. Where's my... Next, I'm going to perform the Babinski test. Okay, and the Babinski test was negative, which is exactly what we're looking for. Next, Olivia, I'd like to have you put this heel and start up here and go down your leg. Other one, please. Okay, and a normal finding is that the patient is able to do it. So that's exactly what we're looking for. Okay. So are you having you're not having any kind of muscle or joint pain at all? Could you please put your head to each side? Back and forth? And that doesn't hurt at all, no tenderness or anything like that. Okay. Next thing I'd like to do is, if I'm going to put my hand right here, and I'd like for you to push into my hand with your neck. Push, push. Okay, this side. Push. Okay, and that's a good finding. The patient's exhibiting really good neck strength and coordination. Okay, now I'd like to hold your arms. I'd like for you to push against me. Push, push, push. Okay, now pull against me. Good job. Okay, we'll do the same thing with your feet. Pull against me. Push. Okay, push. Yeah. Oh, wow. All right. Now, pull. Pull against me. Okay, and that's a good finding. That's showing me that the patient has good muscle control. Okay, and I also want to note that the patient's opening their eyes spontaneously. They're very alert. I would give her a score of 15 on the Glasgow Coma Scale today. Okay, Olivia, and I appreciate it. You've done a really nice job. Thank you very much, and that concludes my assessment on the muscular and neuro.